I'm going live. Hey, Liberty North High School, AP Psych. This is Mr. Davis with the afternoon live stream. So we are going to start chapter 16 and 17 today. So these will be our last two chapters of the year. So again, the end is getting near. Seniors, you have less than a month. Obviously, I think you're still getting out May 22nd. Juniors, we have May 22nd. So it's almost a month right on the nose left. So we are in our last, basically 17, but we'll just cover them as one chapter. So we're in our last chapter of AP Psych, which is, it's been a long road. And again, I just miss taking this last journey with you guys and having you in class, and just miss seeing you guys every day. The great questions, the great interactions. You guys are a blast this year. Again, the only thing you have to do in chapter 18 is just do your AP notebook stuff and then submit your lab, which several people are already doing. So then you're done. This chapter, I'll put up the assignments. With this chapter, the good thing is that the labs will be done via live streams. So when we start taking notes over the different types of disorders and treatments, you're actually going to put those in a chart. And then that'll be your lab. So, and the chart I've been doing for years, and actually the chart has helped at least 3 students pass the MCAT, behavioral science or behavioral medicine part of the MCAT. So they just kind of went back and referenced that. So again, some of you will be taking abnormal psych in the future. I think it's still in the top 3 most popular elective classes in colleges in America. And it's a good little reference for you as you move on. If you want to take that class or do anything with abnormal psych or psych disorders in the future. So we'll make 2 charts. One will be disorders and one will be treatments. And we'll do them. We'll start tomorrow with the live stream. We'll actually work through it together. Today is just some intro notes. Okay. So I hope everybody's doing well, and let's get started. So chapter 16 is psych disorders. So the information on this sheet is going to be AP learning targets, probably I think 1 through 5. So 1 through 5 are kind of just some historical intro questions about the topic. And I have your up-to-date learning targets in Canvas. So in this chapter 16 and 17, but it's already in there. So you can look at that. And then I'll take a picture of the vocab and put it in the assignment when I'm there. There's really not much vocab. Chapter 17, there's very little. It's pretty short. So last vocab as well. So it's just kind of crazy that it's ending. All right. So just some introductions. Okay. So this topic, psych disorder. So generally, if you take it in college, it's going to be called abnormal psychology if you take it as a whole class, or it might be called psychopathology. And then generally in the chapters, in the regular psych, is called psych disorders. Okay, so they're kind of all universal, if you will, kind of synonymous with the topic. Psychopathology literally means illness, study of the illness of the mind. Okay, so that's kind of the medical science term for it. So I think in some places the class is actually titled psychopathology, especially in medical schools, but it's the study of origins, symptoms, and development of psych disorders. Okay. So this would be the medical scientific term for it. Okay. Then what we need to do is make sure we understand the difference between psych disorders and mental illness. Okay. And I will tell you here that I don't think the clinical field and probably the whole field of psychology is unanimous on the difference between these two. And it becomes very blurred and very murky at points. I'm just going to go with a summary of kind of the articles and information I've read, and also how a fellow teacher kind of once explained it to me, which is, the differences between an illness and a disorder. If I were to ask you which one is worse, you're probably going to say disorder, right? Which is true. So psych disorders are kind of the apex, if you will, of dysfunction and illness in psychology, right? So these are very severe. They generally impact life on a huge scale, and your whole level of functioning as a huge scale. We'll go down here, but generally disorders they cause deviation, distress, and dysfunction. Okay, this would be, so the difference here, an example would be, you can be treated for anxiety, be diagnosed with anxiety, right, from your doctor or wherever. You can even be seeing a psychiatrist and receiving therapy and illness, but you still do not have an anxiety disorder because you don't fit the diagnostic criteria, okay? So this is kind of like the apex. Now, anxiety could lead to an anxiety disorder. It doesn't have to. But mental illness are generally, hopefully, more short-term. They're less pervasive. They're less dysfunctional. Like I can have anxiety and still get treatment, get therapy medication, and still then continue my going to school, going to work, hanging out with my friends, so on and so forth. Not to say that it's not very difficult at times and it's very unpleasant, but at the same time, if I had a disorder, that all would become very, very difficult. Okay, so again, another example, which we talked about, mental illness can be treated by your primary care physician and therapist. But if you get a psych disorder, you have to go to a psychiatrist and a psychologist. That's where you're going to get help. Okay, you have to go to the more medical side that really specializes in dysfunction and illness of the mind. Okay, mental illness. Hopefully, you'll either get over it, because again, the brain is an organ. It's just like any other organ in our body. It can become sick at times, and that's what happens. Now, hopefully, that sickness is temporary. With medication and treatment, you can kind of get it right back on track. And then everything's good. And then maybe you'll have little setbacks along the way, or maybe it will just kind of moderately impact your life for the rest of your life. But here, these people, it's just a part of who they are. And it's much more impactful, negative, much stronger symptoms, if you will, more severe. Okay. All right. So we're mainly going to be looking at this side of it. Okay. So we're going to be talking about all the disorders and their diagnostic criteria and so on and so forth. Okay. Now, again, as we work through these disorders, there's always going to be times in which you're going to say, oh, that's me, or that I have that symptom. Again, and we throw around terms like psychotic, psychosis, germaphobe, neurotic. We throw around a lot of terms. We kind of culturize a lot of terms. But you have to remember that if people have a disorder, it's with them all the time, and it kind of takes them out of life. It makes life very, very, very difficult. And so that's kind of the big difference there that you need to keep in mind. The DSM-4 called it global functioning. I think that's a pretty good term. They removed the scale in the DSM-5, but I think that's a pretty good way to learn it and look at it. Okay. All right. Then normal behavior is generally defined by categories or specific qualifiers, if you will. I also have the term disordered up here, which I'll take a picture, but I'll show it. So disordered. So I don't know if anybody's heard the term disordered mind, abnormal mind. Okay. So I've kind of written down kind of 4 qualifiers for abnormal or disordered behavior. So another way you can kind of look to see if you fit under a psych disorder. First one is it deviates from the social norm. So that's very important to remember, is that, and then realize is that culture influences and kind of dictates what's normal, right? So this answer, deviation, is actually defined by culture. And believe me, there are massive behaviors that are socially acceptable and normal that would be considered absolutely abnormal in our country and illegal. So, in certain Latin America, especially if you start looking at ancestral worship, there are certain cultures that, as a part of worshiping their ancestors, they partake in cannibalism. They eat part of their ancestors as a way to pay honor and to carry them with them. That's obviously illegal and would qualify you as mentally ill or with a psych disorder here in America. Plus, it's illegal. And then in certain Latin American countries, they have, like, when they celebrate the Day of the Dead or they celebrate anniversaries, they all dig up their relatives and put clothes on them and parade them into town. Okay, I know digging up a corpse is illegal in America. So, those would all be extreme examples of behavior that is definitely deviates from our social norm, but it fits the standard and the norm in those countries. Okay. So deviates from the social norm. It is maladaptive, which maladaptive means that they refuse to change. So they know that their behaviors and their thoughts are dysfunctional, they're painful, but they don't change. They just are not good at changing. Even though it creates pain in their life, they just are not very good at changing, or their mind does not allow them to change. Okay. Causes personal distress, self-defeating. This basically just means it causes personal pain. So not only do I, again, not want to change or don't change, but it causes me pain. So, you know, it hurts my relationships, it hurts my health, you know, hurts my be able to have a job, friendships. You know, it just is very, very tough, and it impacts life. Okay, and then number 4 is it's just fun. Okay, it just doesn't work. It doesn't allow me to keep a job at times. It doesn't allow me to be able to support myself or my family. You know, it doesn't allow me to interact with other people, form relationships and friendships. Okay, so as you can see, this medical condition is going to create a lot of issues, and that's kind of what we look at it. Is the more it impacts my life, the more serious it is. The longer it lasts, the more serious it is. The more severe my symptoms are, the more serious it is. Okay, and that's where we get here. Okay, but again, I think to summarize, disordered or abnormal means it deviates, it's distressful, and it's dysfunctional, kind of the 3 Ds. Okay. All right. Now, and actually learning target number 1 is the DSM-5. So it actually asks you, how do we diagnose and classify disorders? And that is with the Diagnostic Statistical Manual, which is in your learning target 5. So this is the 5th revision. So what we have is we have a manual that we use to classify and diagnose disorders. So for you to even be diagnosed with a disorder, you're going to need to see a psychiatrist or psychologist, and they're going to have to access the DSM-5 and see if your symptoms match the qualifiers, okay, to classify and diagnose. Now, the main thing about the DSM-5, we also need to know is it does not treat. Okay, it doesn't give me treatments. It just classifies and diagnoses, all right? So, again, in the 1950s, before the DSM was created, you know, I could see 7 different psychiatrists, different disorders, 7 different diagnoses. So what we've done is since the 1950s, we've gone through 5 revisions. I think this one, DSM-5, there's over 400 clinicians from 13 different countries. You know, it's supposed to be a universal tool. It's worked in collaboration with the WHO, World Health Organization, and they kind of have their own manual as well. And it's on the 11th revision. I forget the name of it right now. But so they work collectively together to create a manual with psych disorders. So it's going to tell you, it's going to classify all the disorders, and it's going to give you diagnostic requirements, which again are specific symptoms, time, length. I mean, it's very, very specific when you look at the manual. And again, I have the DSM-5 on my desk. I would have handed that around today and let you guys all kind of thumb through it and look at it. But it has definitions, specific qualifiers, symptoms, and things like that. Okay. So that is how these are diagnosed. Okay. Not how they're treated, but how they're diagnosed. So again, I can go to my primary care physician if I think I'm having anxiety, and they'll give me probably the Beck anxiety scale. And if I fail that, basically they're going to say, yeah, you probably are having something. And they can prescribe you medication. They can suggest you see a therapist. Okay. But they cannot diagnose me with a psych disorder. They'd have to send me to a psychiatrist, psychologist who's actually an expert in that, and then could diagnose it. Okay. All right. The next thing is the difference between psychotic versus neurotic. So this is a very culturally loaded term, psychotic or psychosis. I think you hear people say a lot, oh gosh, that person's psychotic, you know, or whatever. So basically all mental disorders, psych disorders, can be categorized into one of these 2. Some of them are more blurry than others, but psychotic is basically the severe form of psych disorders. That's when I break from reality. So any disorder that causes me to break from reality is considered a psychotic disorder, and has psychotic or psychosis as a part of it. Okay, so psychosis basically means I have broken from reality. I've become delusional. I'm not based in reality by thoughts or anything like that. Okay, neurotic, which actually is a term in the Big 5. So it's actually going to give you a dimension of neuroticism, right? Which actually kind of goes up here to, in our country, this has been called the age of anxiety, and is anxiety or becoming neurotic, becoming more of a social norm, okay? But neurotic basically means an abnormal level of fear and anxiety, okay? So you have basically disorders that are based kind of on some type of anxiety, fear, and then you have some that are kind of based on or has as a component that we break from reality. Okay, so obviously these are the more serious disorders, and then most of them will have this component here at some point. They're going to have a component of fear, even if it's about fear about having the disorder or having symptoms. Okay. All right. And the last one is kind of the, I think it's learning target number 5. And it kind of talks about how, you have medical language, psychological language, and you have law language or culture language here. But criminal insanity is a great example. Insanity is not a psychological term. It's not in the DSM-5. In the clinical field in psychology, they don't use the term, okay? And insanity does not mean that you're psychotic either. So again, if a criminal wants to plead insanity, basically what they're saying is that they didn't, because of their condition, of whatever it is, it could be a psych disorder, most of the time it is, they cannot tell right from wrong, okay? So that does not fit the psychological definition of psychotic. Okay, now it could if they broke from reality, but insanity means that regardless of my mental state, I did not understand right from wrong. And very rarely is it actually it's very rare that it's actually the plea is won. Most of the time, no matter what the psychological disorder is, they can find that you knew right from wrong. The other thing to remember, again, with the stereotype is people who have psych disorders are like I think it's only 1% are violent or criminals. And then the 99% are generally not a danger to anyone, but if they are a danger, they're more a danger to themselves, which we've talked about as we've gone through the class. So, but in some cases, and you see movies in which they do this and people, kind of can fake it and so on and so forth. And again, all you have to do, and it's very easy to prove that they either they did or they didn't know what they were doing was wrong. A great example is Winston Moseley, who murdered Kitty Genovese. He pleaded insane. He was defeated very quickly because all they had to prove, they didn't have to prove that he had a psych disorder. That didn't matter. What they had to prove is, did he know right from wrong? And the fact is that, when he was attacking Kitty the first time and the person yelled down, hey, what's going on down there? He ran. He got up and he left. That shows that he knows what he was doing was wrong. In addition, when he came back the second time, he put on a hat and put on a coat. He changed his appearance. Okay, that indicates he knew what he was doing was wrong. Okay, now, did he have a disorder? Yes, he did. And I've heard different things. I think antisocial personality disorder, borderline personality disorder. I think were the big ones that I saw, or some type of psychosis. But that doesn't matter. He still knew right from wrong. Okay, and that's the big difference there. Okay, so I think the learning target says identify positive. Nope, that's not it. It's number 3. Okay, it discussed the interpretation between psychology and the legal system. Okay, so again, legal system has its own terms. Psychology has their own terms. Okay, and sometimes we like to morph them together or make them synonymous when they're not. So this stuff is for the medical field, right? For diagnosing and treating disorders. The legal system is to prove, accountability, to prove guilt or innocence. That's kind of what it's about. Okay, and here are your AP learning targets. And then what I did is I actually on Canvas, when you pull them up, it actually has them broken down into 16 and 17. Your first 10 are 16, and then the last 5 are 17. Okay. All right. So those are on Canvas. All right. So we'll stop there. So then tomorrow, what we'll do is we'll set up our chart, and then we'll basically cover all the disorders that are in the book that the AP requires, and that generally the dual credit from Rockhurst requires as part of this course. And we'll go down, so you'll have this nice, neat chart of all. I think we cover 15 disorders. So we'll go down and we'll give the name, the category, the symptoms, the causes, are they psychotic, neurotic, and the treatments. Okay, so we'll go down. So if you took Psych 2, you kind of did something similar, but we'll just go down and do that, and then that way you'll have them all in, and then you just got to take a picture of that or share it with me or whatever to turn it in, and then we'll do part 2 of the chart, which is the treatment chart. Okay. All right. Any questions so far? Are we good? Okay. All right. Well, everybody have a happy Tuesday. Enjoy the beautiful weather.